Your lab tests are normal, but you still have pain. Could you have rheumatoid arthritis? Hello, this is Dr. Siddharth Tambar, expert in rheumatology and regenerative medicine. Common presentation that I see in the clinic every day is that someone has had pains for some time, maybe a few months. Their physician has checked some labs, maybe they've checked some x-rays. They're told that their labs are normal, and so they're told that no, they don't have rheumatoid arthritis. Is this accurate? Well, let's go through that. So keep in mind that at the initial diagnosis of rheumatoid arthritis, 50% of patients will actually be antibody negative. And frequently their levels of inflammation will also be negative. Rheumatoid arthritis is a clinical diagnosis where we need to consider not only your labs, we have to also consider your exam, your imaging findings, your symptoms as well, because the condition itself is where your immune system is overly active, causing inflammation in the joints, and there's not a 100% diagnostic one-test diagnosis of this. So positive antibodies or lack of antibodies does not necessarily mean that you have disease activity. So to determine whether there's actually active inflammation, we need to look at either your examination or positive imaging, such as ultrasound or MRI, to see whether you actually have active inflammation. Also keep in mind that frequently x-rays are checked when people come in complaining of pain, and they don't show inflammation. Like x-rays do not show inflammation, they show fractures, they show wear and tear arthritis. They can sometimes show chronic damage in RA, but they don't really show inflammation reliably. So x-rays are not really helpful from an early RA diagnosis standpoint either. So if your labs are positive, but there's no inflammation on exam or imaging, I would say, no, you don't have RA, even if your labs are positive. Or you don't at least have active inflammation. On the other hand, if your labs are negative, but you have inflammation on examination or imaging, then I would say, yes, you have inflammatory arthritis, and it's possible you have rheumatoid arthritis, or what we would call seronegative rheumatoid arthritis, where the labs are normal, but there's signs of inflammation and you meet the clinical criteria for RA. So to sum up, if your labs are negative, but you've got pains, but you've got classic presentation for RA, namely pains on the right and left side of the body, swollen joints, prominent hand and wrist symptoms, and going on for more than 6 weeks, you might still have RA. You should get checked out by a rheumatologist as well to see if you objectively have inflammation and if you objectively meet criteria for RA. Thanks for your time. Give us a like, subscribe to the channel. Until we connect again, have a good day and live well. Bye-bye.